Thank you, Mr. Malhotra, and the august dignitaries here present on the dais and all the audiences. It's my privilege to uh, tell you about this flagship program of Government of Rajasthan, that is Pregnancy and Child Tracking System. In fact, it was one of its first initiative in the country, and it has been, in fact, highly appreciated by not only national level agencies, Ministry of Family and Health and Family Welfare, but also by WHO and UN Health Group who had come. And in fact, we have demonstrated it to the World Bank and many people who have come from abroad. And in fact, I remember when I had demonstrated it to Mr. Anish Chopra, who was the advisor to President Obama, he was amazed. In his group, there was one advisor on health also. They were amazed to see that such a kind of system can exist in India. Okay, and that happened in Rajasthan. So I would like to start, I don't know how much time I have, but in 5-10 minutes I would like to start with the genesis. In fact, when we are talking about e-governance, how it started, all of us are talking about e-governance now, but let me take an example of Medical and Health Department. The ministry wanted form number, they have multiple forms, which have to be collected from sub-centers. And then the information is to be collated and used by the state, district, and the national level. But it so happened, in fact, ever since I joined NIC, I had several meetings which was even, there were programs which were funded by UN. But the biggest challenge was that the structure of Family and Welfare Department is so vast that by the time you print a proforma, you finalize a proforma, and you deliver it to the end point sub-center, the proforma is changed, itself is changed, okay? So now how to start in a department like that, So we thought that, okay, let us start with the minimum MIS kind of reporting. And we thought that whatever monthly returns were coming to them, which were of utmost importance, because those figures were to be remitted to the national level, and they were used for indicators, health indicators by every agency. So we thought that let us start as an MIS system. Okay, now the kind of problems we faced, because these are all field offices, you deliver computers whether they are received or not, and the communication systems are not so strong at that time. So in fact, that's how the MIS had started in such a bad shape, okay. Then there was a complete change of mindset now, what I see. Now the health department is using it to such an extent that I'm so proud to say that there is hardly any paper movement as far as MIS is concerned. Okay, the data is entered directly at the CSC level, and from there it flows completely on the centralized system. And the system which we had initially termed as healing, it is basically a suite of applications for medical and health department, which includes IDSP, integrated disease surveillance programs. It has malaria monitoring, it has tuberculosis monitoring, it has blindness monitoring program, it has cold chain monitoring program. Okay, it has drug controllers office, they could identify which drugs are to be banned and how to monitor them. So all those modules are there. So I call healing a complete suite of application for medical and health department, and it is running today and it is being used today. Now, pregnancy and child tracking system is an offshoot of that system. When we were working on MIS, the thought was that why not capture data directly from the sub-centers? But as we all know that connectivity and infrastructure is a major problem. So there were forms which were designed, and since it's a centralized system, there was no paper form which was printed. Okay, the forms were designed, they were programmed, and it's in a very comprehensive manner using the information which was already available in the system. The individual beneficiary who was seeking treatment at sub-centers was recorded. Okay, and every month this data flows. Now this data is flowing regularly, even at the frequency of 1 week. Some of the substances is almost real time. In fact, the evening the data will come to CSC and PSC, and from there it will be uploaded. So now the system has grown to such a level that we have around 4.5 lakhs of the population who has benefited by various schemes of pregnancy and child related schemes, immunization, and antenatal care, postnatal care. So all these beneficiaries databases are available, and they could be tracked to each and every pregnant lady, each and every woman, Asha Sahayogi, and the A&M who is providing support to them. Similarly, we can plan for a vehicle in advance for the institutional delivery, and in fact the health department has on many platforms has said, I don't have the figures often available with me, but it has actually reduced the IMR, and it has increased the IMR and decreased the MMR. Okay? So that is the benefit which has been achieved. And in fact, all of you are welcome to see there are certain things like Janani Suraksha Yojana where the payments are being made to the beneficiary as an incentive. So those lists also have been put in the open domain on the web, and anybody can see. That has also introduced transparency. There were earlier complaints that the people who are helping Asha Sahayogini or who gets the pregnant woman, they are paid the incentives, but it doesn't reach the woman herself, but it is taken away by somebody else. So now that list also is put up on the web, and anybody can see. Gram Sabhas also can see, and it has introduced a lot of transparency. Similarly, as an offshoot of this entire system, it is possible to plan that which are the areas where the service is lacking, okay, or where the reach is less. So where the drug supply is a problem. So in fact, department is using it now at all the levels. In fact, I'm amazed at how well the department, who was, when we had started, was not even aware about the computerization, and MIS has taken it up so well that now they are so dependent and they are using it on their own without any paper movement or without any hitch, in fact. And they are coming up with new models every now and then. We have also integrated SMS gateway to it so that well in advance the beneficiary can be told that now the immunization date is due on such and such date, and you please bring your child for immunization. Similarly, with these statistics, it's possible that in such and such sub-center, this will be the requirement of injections and the vaccines, etc. So that can be predicted. So in fact, it has been appreciated at all the level. In fact, the Minister for Health, Mr. Ghulam Nabi Azad, had also released this system in Rajasthan state. Thank you. Thank you.